They wrap around the urethra, the vaginal opening, and the anus. And if you're a male, it's the same, just one less hole. So the shaft of the penis instead of the vaginal opening. And they contract to hold back gas, urine, and stool. They relax to let out gas, urine, and stool. They also relax to have pain-free penetrative sex. And then the next layer is more a diaphragm that supports the bladder and the urethra. And the innermost layer is why we call it the pelvic floor. So it's the basement of your abdomen. And again, it wraps from the pubic bone to the tailbone. And you can see this deeper layer is covers a lot of territory at the bottom of your pelvis. So it has a huge role in stabilizing your hip as well as the sexual bowel and bladder function. It's also part of your core. So your core is a canister. It's a lot more than just your abs one-dimensionally. It's your ab muscles in front, your back muscles, your respiratory diaphragm, and then what we call the pelvic diaphragm or the pelvic floor. And all of these work together. They rise and fall with breath. So as your lungs fill with air, everything drops a little bit to accommodate that intra-abdominal pressure. And as your lungs empty, your abs kind of push in, and so does your pelvic floor. So they have a huge role in organ support, pelvic support, low back and spine support, as well as the other functions we talked about.